Hey everybody, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And here with me today, I have the co-founder and president of Komodo Health, Web Sun. Hey Web, how you doing?
Hey Jess, how are you?
All right, so initially we were going to jump into Komodo's new partnership with the Chan Zuckerberg Initiative, and we will get there. But first, I've got to address some IPO rumors, buddy, that are coming straight out of the mouth of your co-founder and CEO Arif Nathoo. What is going on? I read this Fierce Healthcare article by Heather Landy, great article about the partnership, and then there's all this talk of IPOing this year. Is there something you'd like to tell us, Web?
I know you always put everyone on the hot seat, and we'll have a little fun with that. I'll just say, for starters, the market receptivity to our healthcare map and software first approach has been incredible. And we will continue to invest in the offerings and capabilities that we know our clients need, while also expanding into ever more new segments across all of healthcare. And it is very validating. We're incredibly well positioned for continued growth. We have great options for capitalizing the business to continue to pursue our mission. And that's really our focus right now, that mission to reduce the global burden of disease.
Oh, wow, those talking points. It's like famous. WTF Health is famous for its IPO talking point answers. You did not disappoint. All right, well, when the big news does break, we expect you to come back because that's also becoming like a tradition here, all right?
I
So let's
promise to
talk
do that.
about this Chan Zuckerberg Initiative partnership because this is really cool to me. So you guys are using your healthcare map, which we'll talk a little bit more about the technical side of that in a second here too. But you guys are offering your healthcare map to the patient advocacy organizations that are involved in their rare disease initiative. So say a little bit more about this. Tell us exactly what's going on here.
Yeah. First of all, we are incredibly excited about this partnership between Chan Zuckerberg Initiative, known as CZI, and Komodo Health. And we are humbled by the opportunity to partner with so many patient advocacy organizations working across some of the most challenging and complex disease areas. Now, I'll start with from my vantage point as a co-founder, I've been really struck. You meet with so many patient advocacy leaders in rare disease by how personal the mission is for them, by how little experience and expertise many of them have in navigating the complexities of healthcare, by how little support they've oftentimes received, and really by how uniquely positioned Komodo is to support them and their patients across a wide range of use cases, ranging from everything, what we call shortening the diagnostic odyssey for patients and getting them diagnosed and treated much earlier, all the way to connecting them to potentially life-saving clinical trials and therapeutics. Now, with respect to CZI, we're really excited. Their Rare as One network spans over 50 organizations that will now all have access to Komodo's software and analytics firepower to help improve earlier diagnosis, to help close gaps in care, to help reduce what I just referred to as the diagnostic odyssey, and to really accelerate research across some of these incredibly complex, incredibly difficult to diagnose and manage diseases. And this is when I talk about Komodo being uniquely positioned, it's really critical to understand that patient journeys for rare disease patients are very uniquely different
Right.
from kind of general medicine's disease categories. They're historically challenging to track and analyze. And our underpinning, the foundation of our entire full stack approach, the healthcare map itself, when paired with our software, kind of meaningfully unlocks a deeper understanding of how these patients progress in terms of their disease. And so when you think about, detailed information like patient journey, where they reside, demographic data, disease stage, our ability to pinpoint these rare disease patients and the relevant providers that are managing them is really, really powerful. And we're excited to make a difference via this partnership with CZI.
That is so exciting. I mean, and I love how this brings to life as an example, really a case study of your tech, because I think that's been always like the hard part of this, at least for me. I mean, I'm not a tech person, more like it's at the core here. I like following it and I like understanding how, the opportunities that it creates to do things better and different. But it's like, this to me really illustrates exactly what the healthcare map is in terms of bringing together a full patient journey longitudinally and following a patient from doctor to doctor, diagnosis to diagnosis, test to test, all of that stuff. data, and then also being able to apply your analytics and your software to it to figure out like, okay, now what do we do with this? So I think this is such an interesting initiative just because of that. I'd like you, Webb, if you can, talk a little bit about the components of what Komodo is offering here so we can even more fully understand like what this will do in that context. So like when it comes to like healthcare map, I know you guys just added like demographic data in terms of one of the data sets that you guys are pulling in. Talk to me a little bit about that. And then talk to me in terms of the analytics, like what adding some of those new data points means in terms of what you're able to find out and how you're really able to illuminate what's going on from the patient perspective.
Absolutely. You know, we always talk about our software and we always talk about our products and we talk about all the different capabilities that our solutions unlock. I think it's easiest to understand the value we're going to deliver by talking about very specific use cases that are delivered through our platform, through our software. And so I'll share 3 examples for starters. The first one really begins with disease research. When you have longitudinal data that shows complete patient journey, what that empowers researchers to do is find new symptom patterns that can be used to shorten that time to diagnosis and really meaningfully shorten that diagnostic odyssey. If you think about the challenge of getting an accurate diagnosis as a rare disease patient, this affords us and our partners the opportunity to give a patient back years or even decades of their lives with an opportunity for meaningfully improved patient outcomes. So that's like one example, right? If you think about a rare disease patient who often goes from primary care physician to specialist, specialist back to primary care physician, now to a different specialist because they're presenting with these hard to understand, hard to diagnose set constellation of symptomology, set of comorbidities. Everyone is really looking at their very specific niche part of that patient odyssey. A cardiologist is going to look for cardiovascular and underlying conditions related to cardiovascular morbidity and mortality. A nephrologist is going to be looking at, kidney related conditions, and no one's kind of stitching together that understanding of what this rare disease may be presenting with earlier in the disease versus later in the patient journey. And so that understanding and the ability to define the cohorts that are most at risk and most likely to eventually receive a confirmatory lab, a confirmatory diagnosis, that's incredibly powerful.
Yeah.
The second use case I'll touch on here is really around trial planning and physician outreach. Now, when Komodo operates at this intersection where we work across, underlying partners that serve, clinical research. And we work with partners that are in patient advocacy organizations that are trying to serve these communities. And when you work at the intersection of the two, what that allows us to do is connect patients, these rare disease patients, with the companies that are actually investing into innovative therapies and studying potentially innovative breakthrough treatments for these conditions. And so it's an incredible opportunity, and we've actually proven this out through our partnership with the Cholangiocarcinoma Foundation in terms of how we can bring these parties together in order to potentially connect patients with potentially life-saving novel therapeutics. Now, the last piece here, the last use case I'll touch on is really what we refer to as specialist finder. So once a patient does receive an accurate diagnosis, it's really critical that they find the right specialists with experience in managing that condition. And we need to find specialists that effectively engage with other specialists and have access to the aforementioned clinical trials and new therapies. So our solutions also incorporate clinical activity, research activity, scientific activity for providers all across the nation, and our ability to see how those patients traverse the healthcare system from one setting of care to another, from one specialist to another, really allows us to find the right care teams that will allow us to engage both in the community setting, which is oftentimes where you're going to find these patients and test these patients much earlier in their journey, vis-a-vis the specialists that are operating in the top academic medical centers who everyone typically knows.
I love this. The footnote here for us, some of the data points about the healthcare map that you guys have. Like I heard or read 330 million patients. Some of them, it goes back 6 years. So their data. Give me more of that. Like give me a little bit of a footnote here so we understand the size, the scope, the scale of what you guys have built.
Yeah, I think when we think about the healthcare map, it's pretty funny because a lot of competitors, other companies in the space, everyone's going out and touting, we also have 300 million patients, just
Right.
like Komodo, right? Everybody is saying that. And I think you have to dimensionalize the challenge of creating something akin to Komodo's Healthcare Map. Now, there is breadth, which is we see more patients than anybody else. There is depth, which is really the longitudinality of the map and seeing that kind of patient complete journey. And then there's other factors that you've alluded to: race and ethnicity. You've alluded to demographic data. You've alluded to all these other features. We call them features on patients that you can bring to bear. And then finally, through technology, there's the speed element, being able to surface more of the insights that are relevant to your end users faster than anybody else. We've dimensionalized this problem by looking at all of those inputs and creating the most comprehensive longitudinal view of, nearly census at this point in terms of the number of patients interacting with the healthcare system and being able to see more of their encounters with the healthcare system than any other partner in the ecosystem.
I want to go back to that demographics data for a second, because you and I had a chance to talk at JPM week for Fierce Healthcare. And we talked a lot about data and the data that Komodo has access to in the context of health disparities, and how you're able to look at the data that you have and better identify gaps in care, better identify disparities, inequities in the healthcare system. And one of the things that was so curious to me was that up until recently, demographic data was not involved in a lot of these things. I mean, we talked about it in terms of clinical trials, how that was often a data set that was not considered. So, well, get us up to speed on this. Like, what is this new look at demographic data providing us? Is it really just a byproduct of this conversation that healthcare at large is having about being able to better identify where there might be health disparities? And like, how are we using this demographic data in a way that is supporting the resolution of those, as opposed to, making it worse in some way?
Yeah, absolutely. Fundamentally, this all ties back to health equity, right? We can't overstate the importance of this in all the work and all of the innovation that's happening across healthcare. And at the end of the day, we fundamentally believe that the pathway to health equity begins with a solid understanding of gaps in care for historically underserved patient populations. Now, you can't address health equity unless you have demographic data on these patients, unless you understand race and ethnicity with respect to the patient populations that are part of your studies, are part of your drug eligible populations. And what's been interesting to me is this shouldn't be new. Yet we're bringing this to market. We've featurized this in our platform and in our solutions, and the demand from all of our partners, whether it be life sciences companies, whether it be clinical researchers, whether it be risk-bearing entities, the demand has been through the roof. It's off the charts because everyone understands the need to have better insights on this front, and yet everyone acknowledges what we discussed when we connected earlier this month, which is the fact that you talked about clinical trials. Despite so many efforts to drive diversity in clinical trials, there's well-published proof points around the fact that as an industry, as healthcare, broadly speaking, we've made basically zero progress on this front, and that needs to change because our approach is giving our partners a window into the opportunity. It's also highlighted how much work needs to be done and how we can harness technology to improve health equity and reduce the burden of disease for all.
I know you also work with health plans. Can you give us an example or two about what you're seeing there in terms of looking at the data through that health equity lens? I'm curious about that. I mean, we talked, like you said, about clinical trials quite a bit, but is there another good example that you can share with us that kind of brings that concept to life from the health plan side?
Absolutely. If I'm a health plan, my challenge has always been I only see what I see. And this is true of every stakeholder across healthcare. If you're a provider system, you see patients when they come into your four walls and you have no idea what's happening to them the second they leave your clinic, right? If you're a payer, you see what's happening to your patients and to your member populations, but you have no idea about the broader population or broader set of patients across the entirety of the US. And so a lot of folks are coming to us and essentially saying, you know what, Komodo has this unique ability to essentially enhance or enrich my understanding of what's happening to my patients. And this is true of anyone with first-party data. You could be a digital health company. You could be an innovative healthcare IT company. Everyone with first-party data, you could be an EMR company. You could be a lab. Everyone with first-party data is essentially saying, I only see what I see, but the opportunity to partner with Komodo creates a lens into better understanding the entirety of the history, the entirety of the story around patient costs and outcomes as it relates to the folks that I see and the information and insights I have on them today.
Is that your competitive advantage, Webb, for Komodo? Is it that longitudinal, that map, that full view of the patient that you guys provide that's really the thing that sets you apart from competitors in this space, like a Clarify Health, which also has a lot of data that it pulls from, or like even some of these new businesses like Truveta, which is like, it's like more than a dozen hospital systems that are pooling their data with the effort to try to like be able to provide more analytics on top of that and suss out some of these insights. I mean, is that the thing that sets you apart?
Great. I think, first of all, I'll start by saying what sets us apart, I believe, is in 2014, when we founded the company, we took this full stack thesis to the market. And we said, we are going to invest in providing advantage and insights to our partners at every level of the stack. Whether that be the underlying data assets, i.e. the healthcare map, whether that be, the platform capabilities we've created in terms of enabling developers to build and deploy new analytics against the healthcare map, whether it be, built-in analytics modules that we've deployed against the healthcare map to accelerate feature development for other developers, both internal and external, or whether it be at the application level itself, in terms of being one of the first to come to market with data native enterprise workflow solutions. We have continued to invest in extending that lead in that approach at every level of the stack. And so when we talk about the operating Komodo Health at the intersection between data and technology innovation, i.e. software, we believe that that is really where our advantage exists. Now, when you think about it, we are also enabling the entire industry, all of healthcare, to end its traditionally over reliance on legacy data aggregators. We are ushering in a new era with respect to taking this full stack approach in terms of bringing together raw data all the way through platform, all the way through to data native workflow solutions. And if you compare and contrast that with traditional approaches to looking at patients and trying to define or address disease, instead of buying, managing, mastering, warehousing, analyzing data on your own, hiring consultants, bringing together systems integrators, warehousing it, putting together a data lake via an enormous ecosystem of partners. That's part one. Instead of defining complex diseases based on a market basket of pills being distributed through a retail pharmacy channel, all of our partners, life sciences companies, clinical researchers, patient advocacy groups, and a whole host of other stakeholders really can get instant access to the highest quality insights using our approach, using our software, and through partnership with Komodo.
All right. Well, I think you've definitely got a lot of folks excited about this. That sounded roadshow ready to me, buddy. But I mean, we'll see what happens.
Always putting me on the hot seat.
I know. Well, you'll have to come back and fill us in on what's next. But until then, congratulations again on this partnership with the Chan Zuckerberg Initiative. It's so exciting to see Komodo do such great work in this space and see one of our own health tech companies, with such a high profile partnership and for such a good cause as well. That's amazing. So thank you again for stopping by. It's a pleasure to chat with you, and we'll have to have you back.
Appreciate you having me. And I promise when there's more to talk about, we will.
All right, we should get Arif on the hot seat next, or both of you together. I love it. Thank you so much. All right, everybody, that was Webb Sun. He is the co-founder and president of Komodo Health. We were just checking in with him on those rumors we're hearing, as well as that big news about the Chan Zuckerberg Initiative. I'm Jessica DeMassa, and for more with the who's who of health tech as they are changing the way that we do healthcare, please check out my YouTube channel. It is youtube.com/WTF Health. I'll talk to you guys soon. Webb, take care. We'll talk to you later.
Thanks, Jess.
Bye.